Hi friends, welcome to the channel The Nurse. Here we are discussing important psychiatry nursing questions and answers. This is as per your request only. So in this video we have included some general knowledge questions and aptitude questions also. So please watch this video till the end. And one more request, if you are not subscribed to our channel, please subscribe. And if you're interested to join in our model test series, AIMS NOSET 2022 model test series or jipmer nursing model test series, you can download our Android application, the Nurse Academy, from Play Store, and you can join now. We will move to the questions, psychiatry nursing questions, also general knowledge and aptitude included in this video. First question, it is a direct question. Any permanent change in behavior that occurs as a result of practice or experience is called personality, adjustment, learning, memory. It is a direct question. Correct answer is learning. Any permanent change in the behavior that occurs as a result of practice or experience is called learning. Second question, it is also a direct question. The ability to produce novel and unique idea is called aptitude, achievement, creativity, intelligence. Correct answer is creativity. The ability to produce new or novel and unique ideas is called creativity. Third question. Defense mechanism or mental mechanism is a reaction to frustration, motivation, drive, emotion. Usually, a defense mechanism is used to escape from a frustration. When frustration comes, the persons automatically use the defense mechanism or mental mechanism. Next question. Interest, attitude, levels of aspiration and life goals are the examples of. Interest, attitudes, levels of aspiration and life goals are the examples of. Physiological motives, social motives, personal motives, none of these. A motive is something that causes us to act or behave in order to reach a goal or desired endpoint. A motive is something that causes us to act or behave in order to reach a goal or desired endpoint. Here, the correct answer is personal motives. So, motives are three types: physiological motives, social motives, personal motives. We will check what are them. First one is a motive. Definition of motive. A motive is something that causes us to act or behave in order to reach a goal or desired endpoint. Physiological motive means physiological motives are basic needs like sleeping, drinking water, etc. Same time, social motives means they are any motive acquired as a result of interaction with others. With example, you will understand a little bit better. I will show you example. Before that, what is personal motivation? That is also known as intrinsic or self-motivation, can be defined as motivation arise from an individual's internal desires for the satisfaction and fulfillment of specific needs. So I think it is clear. Physiological motives, social motives, personal motivation. So with examples, you will understand better. So motivation is motives or drives. It is divided into three types: primary or physiological motives, secondary or social motives, and third one is personal motives. Primary or physiological motives, that is we have already discussed, it is a basic needs. It includes hunger, thirst, sex drive, need for oxygen, need for rest and sleep, elimination needs, regulation of body temperature, need for activity. These are comes under primary or physiological motives. Then secondary or social motives. Social motives examples includes creativeness, achievement, aggressions, affiliations, curiosity, urge to security, power of motive, progression motive, mastery motive, gregariousness. These are includes under secondary motives or social motives. Then personal motives means vocational ambitions for job, life goals, levels of aspirations. So as an aspirants, one of the aspirant means you need to get a job in AIMS or you need to get a job in jipmer. This is one of the personal motive. So that is about motives or drives. It is divided into three types: primary or physiological motives, secondary or social motives, third one is personal motives. Fifth question: a problem is viewed as having a single answer with all lines of thinking leading to that answer is an example of. A problem is viewed as having a single answer with all lines of thinking leads to that answer. This is an example of creative thinking, critical thinking, convergent thinking, divergent thinking. Correct answer is convergent thinking. Convergent thinking, that is, all thinking will come towards the same answer. So this is a pictorial representation of convergent thinking. All the thinking will move towards the center or a common answer. For an example, this is a multiple choice question. For this, we got a single answer. So if anyone doing this multiple choice question, he will get into this one answer only. So multiple choice question also, it is an example of convergent thinking. So we will see what is creative thinking, critical thinking and divergent thinking. Divergent thinking, it is just opposite to the convergent thinking, because in divergent thinking, it is the answer will go away from the question, the person. So he will think many ideas or many answers or many solutions. So that kind of thinking, that is known as divergent thinking. We will go to the definition here. Examples of convergent thinking we will see first. Multiple choice test. So for an example, our questions, quizzes, standardized tests and spelling tests require students to use convergent thinking. Each question has only one correct answer. So everyone will come into that particular single answers. That kind of thinking is known as convergent thinking. This is a pictorial representation of convergent thinking. All the answers will come into a single point. Same time, divergent thinking, it is going away. There will be different solutions for a single question. That kind of thinking is divergent thinking. Definition we will see. Before that, students must memorize facts and use logical problem solving steps to arrive at the correct answer. That is a thinking method used in convergent thinking. So logical problem solving steps to arrive at the correct answer. To get a correct answer or single answer, logical problem solving steps need to take. Then we will see what is divergent thinking. Divergent thinking example includes showing a person a photo and asking them to create a caption for the photo. By showing a photo and asking to make a caption for this photo. So each and every person will make different captions. So according to his opinion, the caption will be different. So like that, there will be different or several ideas or several solutions for that single photo. So that kind of thinking is known as divergent thinking. For an example, giving a child a stack of blocks and asking them to see how many shapes they can create with those blocks. So with that blocks, the child can create many types of shapes. Sometimes he can make a shape of square, or sometimes he can make a shape of triangle, or different, or sometimes he can make a shape of animal. So like that, there will be different solution for a single question. So that kind of thinking is known as divergent thinking. Then thinking creatively often requires that's creative thinking. What is creative thinking? Thinking creatively often requires exploring new possibilities, finding unique angles, and using unconventional solutions. So creative thinking means the solution will be new and it will be exploring type. Previously, nobody given that kind of solutions. In that kind of thinking type is known as creative thinking. New ideas are coming, creating. Same time, critical thinking means it is more focused on a logical and rational process of evaluating that which exists already. So already having some solution, and in critical thinking, logically evaluating that answer is correct, or they will evaluate once again in critical thinking. So any ups and down is there for that particular solution, or merits and demerits are there. These are all happening in critical thinking. So that is about divergent, convergent, creative, and critical thinking. Four types of thinking we discussed here. So sixth question: which test determines the person's level of knowledge in the given area or field? Intelligence test, personality test, aptitude test, achievement test. This is also direct question. Correct answer is aptitude test. The test determines the person's level of knowledge in the given area or field is known as aptitude test. Another direct question. Perception is sensation and interpretation, sensation and language, sensation and memory, sensation and image. So perception is sensation and interpretation of sensation. Sensation and interpretation. For an example, we are sensing with our skin with hot or cold water, and interpreting it is very hot or cold. So that kind of sensation and interpretation is known as perception. So perception is sensation and interpretation. What we are sensing, that we need to interpret with the help of brain. So that is known as perception. With our perception means with our sense organs. We have 5 sense organs, and we are sensing with the sense organ and interpreting what we are sensing. That is known as perception. Eighth question. A patient with OCD frequently washes his hands. What is the reason behind this action? He protects himself from infections. He protects himself from dirt. Hand washing relieves anxiety. It is a part of treatment suggested by psychiatrist. Correct answer. OCD, in OCD, hand washing repeatedly that will gives as a relief from anxiety. So in OCD means it is repeatedly without any proper reason, he will do the action repeatedly. So that is for relieving his anxiety. So by seeing our definition of OCD, you can understand better. OCD means it is a disorder is characterized by unreasonable thoughts and fears that leads to compulsive behavior. He knows it is unreasonable, still he will force to do that behavior. That is known as obsessive compulsive disorder. Obsession, that will be there. The unreasonable thoughts and fears, it is known as obsession, and then he forced to do, that is compulsive behavior, that particular activity. That is obsessive compulsive disorder. In some kind of persons will experience will do repeatedly hand washing to remove as a part of removing dirt or preventing microorganisms, he will do repeated. He is doing once means it is a normal activity only, but the OCD persons will do repeatedly. He will if it is not done means he will get a frustration or anxiety. So in order to reduce that anxiety, he has to do that work. Then only he will get a relief from that anxiety. Ninth question: the therapeutic environment for client with bulimia nervosa would be one that is. The therapeutic environment for client with bulimia nervosa would be one that is controlling, empathetic, focused on food based on realistic limits. So, in correct answer is controlling. Bulimia nervosa, it is a binge eating. The person will eat a large amount of food. After that, he will induce vomiting. After eating large amount of food, he will induce vomiting. So that kind of disorder is known as bulimia nervosa. In the same time, anorexia nervosa, what is happening? The person will not eat by fearing of getting weight. So anorexia nervosa, person will not take adequate food, but in the case of bulimia nervosa, person will take more than needed food, extra food he will eat, then induce vomiting. So in that in bulimia nervosa case, we need to provide a controlled environment. So we will see what is that. The goal of the therapeutic environment is to control and break the patterns of binge behaviors. The goal of bulimia nervosa patient in the case of the care therapeutic environment is to control and break the patterns of binge behavior, correct the uncontrollable patterns, and develop long-term behavioral changes. So I think it is clear. In bulimia patient, we need to provide a controlled and break the patterns of binge behavior, that is binge eating, and correct the uncontrollable patterns and develop a long-term behavioral changes. 10th question: abrupt withdrawal of barbiturate use could cause a person to experience. Abrupt or sudden withdrawal of barbiturate use could cause a person to experience ataxia, urticaria, diarrhea, seizures. So correct answer is seizure. Correct answer is seizures. Abrupt withdrawal of barbiturate will leads to seizures. Barbiturates can produce psychological and physical dependence and produce a withdrawal syndrome on a second to fourth day after the drug is suspended. Symptoms of withdrawal includes anxiety, restlessness, insomnia, rhythmic intention tremor, dizziness, seizures, and psychosis. So these are the common withdrawal symptoms of barbiturates. If it is removed or stopped abruptly, withdrawal symptoms will start second day or in between 2 to 4 days. 11th question: before giving ECT, patient is encouraged to empty bladder because. Before giving ECT, patient is encouraged to empty bladder because it may cause renal failure, it will reduce effectivity of treatment, patient may spoil the bed during the procedures, it may cause urinary retention. Correct answer is because patient may spoil the bed during the procedures. Because during the ECT, there is a chance of getting incontinence. So to prevent the the linens getting spoiled, patient may be asked to empty the bladder before the ECT. So there will be chance of getting urinary incontinence during the ECT. That is why the patient is asked to empty the bladder before the ECT procedures. Next question: putting a bitter taste for nails for nail biting is an example of. For a child is having nail biting behavior, then for stopping that behavior, sometimes the mother or parent is asked to put some bitter taste on the nails. Then while biting the nails, he will get a bitter taste. So he will avoid that nail biting behavior. So that kind of behavior change pattern is known as flooding, aversion therapy, systemic desensitization, hypnosis. Correct answer is aversion therapy. So we will see each and every options here. Aversion therapy means it is a psychotherapy designed to cause a patient to reduce or avoid an undesirable behavior pattern by conditioning the person to associate the behavior with an undesirable stimulus. So in that question, the undesirable stimulus, that is bitter taste. The chief stimuli used in the therapy are electrical, chemical, or imagined aversive situations. So we can say it is a chemical stimulant, that is bitter taste. Same time, systemic desensitization involves it is a gradual exposure to the object you fear, but with flooding, you are completely exposed to it all at once. So another option was systemic desensitization. Systemic desensitization means it is usually used in the case of phobias. In the phobias, the person is exposed to the that fearing thing gradually, slowly, step by step. The person is exposed to the that scaring thing. Then gradually the person will be adjusted with that thing. But in the same time, flooding. What is the definition for flooding? Flooding means it is also used for the treatment of phobia. In that phobia case, the systemic desensitization is also used to control post-traumatic syndrome, and flooding is usually used in the case of phobia. So in flooding means the person is exposed to the scaring thing at the first time itself. Suddenly person is exposed to the scaring thing, and then try to adjust with that thing. So that is a difference between systemic desensitization and flooding. Systemic desensitization means it is gradually exposure, but flooding means the first time itself the person is exposed to the thing. And the same time, next question: which group of drugs, also known as thymoleptics? Which group is which group of drug also known as thymoleptics? Antipsychotics, antidepressants, analgesics, anti-Parkinsonian. Correct answer is antidepressants. Thymoleptics means antidepressants. Commonly it is known as antidepressants, but antimanics also is an example of thymoleptics only. But commonly antidepressants are known as thymoleptics. So don't confuse. Here correct answer is antidepressants, but as per definition, antidepressants and antimanics are examples for thymoleptics. Any drug that favorably modifies mood in serious mood disorders such as depression, that is known as dysthymia. From that on, that is related to thymoleptics, dysthymia and thymoleptics. So mood disorder include major depression or mania. The main categories include tricyclic antidepressants, monoamine oxidase inhibitors, and lithium compounds. So lithium compounds used for mania, and antidepressants, monoamine oxidase inhibitors are used in case of depression. So these all drug categories includes thymoleptics. 14th question: the therapeutic communication technique in which the interviewer encouraging the patient to select topics for discussion is known as restating, broad openings, clarification, reflection. From the question itself, you can understand some keywords. So correct answer is broad openings. In that, for an example, for broad openings, the interviewer will ask to patients, what are you thinking about? So it is an open-ended like questions. So patient has to explain in detail. So that kind of communication technique is known as broad openings. Next question also related to communication technique. The communication technique in which the interviewer repeating the main thought expressed by the patient is known as. The communication technique in which the interviewer repeating the main thought expressed by the patient is known as reflection, clarification, restating, humor. Correct answer is restating. For an example, the nurse is saying in between the discussion with the patient, you say that your mother left you when you were 5 years old. So the nurse is repeating the main point, that is the patient told to a nurse earlier that his mother left the patient at the age of 5. So again nurse is asking that particular thing for better clarification. So indicates that the nurse is listening and validates, reinforces or calls attention to something important that has been said. So patient will get a idea. The nurse is listening to his problems, and nurse is validating or getting ideas about that patient's problem. Then the patient will get more confident to tell the patient's problems and all to the nurse or interviewer. So that kind of communication technique is known as restating. Then we will see what is clarification. Clarification, it is also a communication technique. In clarification, attempting to put vague ideas or unclear thoughts of the patient into words to enhance the nurse's understanding or asking the patients to explain what he means. So during the mental status examination, patients will tell more regarding his complaints and all. Then so in some point a nurse will get confused about some explanation, or he is telling someone is telling or something in his ear. So nurse will clarify what the person is getting in his ear, or what was the hearing he is getting. Like he will the nurse will try to clarify with specifically. So that kind of communication technique is known as clarification. Then another technique is known as reflection. Reflection means the nurse will repeat the same thing what patient was said before. So reflection means directing back the patient's ideas, feelings, questions and content. The nurse will repeat what the patient said before. Then patient will get the nurse's idea of the nurse is listening to him, and he will explain little bit more in detail. So that kind of communication technique is known as reflection. Restating means restating and reflection some similarities are there. In restating, the nurse is repeating the major major content only repeating. But in the case of reflection, the whole point will repeat. That is the difference between reflection and restating. Humor also one kind of communication technique. In the humor, the interviewer the discharge of energy through comic enjoyment of the imperfect. So nurse will turn some points into in a comic way, and then the patient will get confident and he will get some relaxation. Then he will open up his problems. So that way of communication is known as humor. Next question, that is from general knowledge. In the Har Ghar Tiranga campaign, between the 13th and 15th August, the government of India has set a target to hoist the tricolor on how many crore houses? In the Har Ghar Tiranga campaign between 13th and 15th of August, the government of India has set a target of hoist the tricolor on how many crores of houses? 10 crores, 50 crores, 25 crores, 75 crores. Correct answer is 25 crores. Next question. Which country recently declared monkeypox disease as a public health emergency? Which country recently declared monkeypox disease as a public health emergency? China, France, India, USA. Correct answer is USA. United States of America has declared that monkeypox disease as a public health emergency. 18th question. Quit India Movement Day is celebrated on. Quit India Movement Day is celebrated on August 15th, August 18th, August 8th, August 24th. The correct answer is August 8th. Quit India Movement Day is celebrated on August 8th. Next is aptitude question. What part of a revolution have you turned through if you stand facing west and turn clockwise to face south? What part of a revolution have you turned through if you stand facing west and turn clockwise to face south? You are facing west side, then how much you need to turn to reach south facing? That is through clockwise movement. Options 1 by 4, 1 by 2 or half, 3 by 4 or 1. So if you understand the question, you can answer here. So I will show you the answer. Correct answer is 3 by 4. So in this way, this is a west side. The person first in the west facing is standing on west facing this side. So this is a west side. From here clockwise he has to move 1 by 4. Then he will reach north face. Then from here he has to move again clockwise. Then he will reach east face. Then total movement will be half circle. Then from here he has to move clockwise to reach south side. Then he has to complete total 3 by 4th. 3 by 4th turning required. Then he will reach south facing. So if you understand the question, you can answer here. The clockwise movement will be like this. So total 3 by 4th turning needed. If he is completing here means it will be total 360-degree rotation, but he is needed to complete 3 by 4th rotation only, then he will reach south facing. Next question from maths. It is a simple maths only. How many months make a century? How many months make a century? 12, 120, 1200, 12,000. Correct answer is 1200. 1200 months will make a century. So in 1 month there is a 12 months, then 100 year. In a 1 year there is a 12 months, then 100 year, 12 into 100, that is 1200 or 1200 months are there in a century. Next question. What number comes before 9019? 9099, 9091, 9109, none of these. What number comes before 9019? Correct answer is none of this. because 9099, 9091, 9109, all the numbers comes after the 9019. In question it is asked before 9019. That is why the correct answer is none of this. All the numbers, all other options are comes after the 9019. So there is no number. So our option answer will be none of these. Then we will come next question. We will come to next question. Look at these patterns. What are the next two numbers? 8454, 8458 dash 8466 dash. So two numbers are missing here. Options 8476 and 8477, 8460 and 8600, 8462 and 8470, 8462 and 8466. You can easily answer here. Correct answer is 8462 and 8470. So here first number is 8454. Then addition to 8454 plus 4, that is 8. Next number 8458. 8458 plus 4, that is 8462. 8462 plus 4, that is 8466. Then 8466 plus 4, 8470. So each number is adding with 4. Then we will get next number. So simple question. So that is about today's video. We have discussed around 22 questions here. So if you have any doubt means you can ask in comment section. So it is a long video. So please watch it till the end. Then only you will get an idea. And thank you for watching this video. Bye bye. Please share with your friends and also like this video. Thank you.